Sexual conduct that is hurtful to a child's mental, emotional, and physical welfare, or compelling and encouraging a child to engage in sexual conduct. This is a very heavy topic. It's something that I'm currently dealing with at my internship, where you wouldn't imagine the cases that come in where children are being sexually abused by their own biological families or their friends or anybody really around them. And just the signs and symptoms are out there. It's just you need to be aware of them. Pain, swelling, or itching in the genital area. That's an obvious one. If a child is hurting down there at the age of 8, chances are they're not sexually active, so you need to keep that in mind and report it to the nurse, and the nurse will know what to do. Difficulty walking or sitting. Frequent urinary yeast infections. Signs of sexually transmitted diseases and pregnancy at a young age. All of these are clear signs that there's some form of abuse going on. Chances are it's sexual abuse because it does deal with sexual nature, but it's important to make notes on it and report it as soon as possible. And later I will discuss what that means. The role reversal and overly concern for other siblings. If a daughter is being sexually abused by her father, she is going to become the mother of her younger siblings because she doesn't want it to happen to them. So she's going to be overprotective of them. Then threatened by physical contact or closeness. If the child doesn't want her own dad or mom to hug her or him, there's a problem there. If it's continual, if she doesn't want that love, then there's something wrong, and it's important to keep that in mind. Then extreme fear of being alone as adults, and then sexual victimization of other children. What is done to them, they're going to go ahead and do to another, like monkey see, monkey do sort of thing. Now that was really heavy. Any questions on the physical or any of the abuse? These are the effects of abuse. Post-traumatic stress syndrome, or disorder, depression, other psychological conditions, behavioral disturbances, substance abuse, regressive behaviors, like they start sucking their thumb later in life when they got rid of it as a child, a baby. Lower self-esteem and poor social skills, impaired ability to trust, distorted body image, school-related problems, fear, anxiety, and hostility, and difficulties in interpersonal relationships. So a child being abused at a younger age, if it's not caught and dealt with through counseling or other treatments, they're going to go on and have a really hard life and not know how to have an adult life because they weren't able to be a child. So why don't children tell? Well, they believe that the abuse is normal. They are used to being beaten by their father, so that's normal. Or they're used to being made to have sex with at a younger age, so that's completely normal to them, so they're not going to think to tell. And then they fear that they will be punished, or their family members will be punished. So if they tell, they're going to get in trouble even more. And so they just put up with it. And then they are often threatened or manipulated into keeping it a secret. I will give you this new phone if you don't tell that I just did that to you, or I will give you these drugs if you don't tell that I just made you do this to me. So those are reasons why they don't tell. And so what can you do as the mandated reporter and community member to help the child get through it? Well, remember to report it because it is the law. And then step 1 would be to gather substantial information. If you see that something is happening that's not normal, write it down in the date. And something else may happen later on, write it down in the date. And when you have covered enough of the information, you report it. And the statewide number is 1-800-252-5400. And we have a shortage of caseworkers, so you may be on the line for 15, 30 minutes. But the 30 minutes you're on the line may seem like a lot to you in your busy day, but it could save a child's life. So it's important to stay on the line and to call. And then you're going to need to be able to tell them the child's name, an area where they live in, who they hang out with, what they look like. Any information that can get them to the child's home quicker is the best. And then it's important to always believe the child. Don't think the child is lying, and don't tell the child they're lying because they're told that enough at home or wherever the abuse is occurring. Don't criticize the child or the abuser, because if you're criticizing the abuser, they're going to be like, oh, I don't want to tell because I love my mom, or I love my dad, or I love my uncle. So don't criticize anyone. Be neutral but loving and caring to them. And to stay calm and reassure the child that it is not their fault. They already feel like it's their fault because it's done to them. Just tell them it's not their fault and be calm with it and be there for them. And remember, suspicion of abuse is all that it takes to occur. It's anonymous, so no one's going to know you did it. And to take action, because you could save a child's life. And then a quote. But does anybody have any questions about any of that?
What if a child tells you something, but you don't, I mean, it's hard, you know, they said, you know, years ago I was abused. What should you do? Should you still report it?
Yes.
Are they still in that environment?
What if they're not in that environment?
Well, the perpetrator's still out there.
Right,
So who's to say that they're not doing it to somebody else?
right.
So yes, if a child tells you, 10 years ago, so-and-so abused me, call the number. But if the child tells me, hey, something happened to me last night, someone came in, my mom's boyfriend came into my room and he touched me.
Like if you're at church or something.
Yeah. Don't say, what did he do to you? But say, oh, tell me what happened. Don't say.
Don't put words in their mouth.
Yeah, don't put words in their mouth because that could mess up the case. But do tell. If they straight out say, hey, I was hit last night with a paddle baseball bat and it left this bruise, well, that's not okay.
Right.
But if you see the signs, you can't. One of them isn't enough to do anything. Keep notes, like a journal without the child's name on it, and make notes. On Monday, January 13th of 2011, so-and-so did this, and this is what it looked like, and keep it. The more evidence you have, the better it will hold in court.
Can you call the police?
You can, but they aren't.
Do not tell you to report it.
Yeah. The police work at the law side, and so they're going to get the CPS involved, and it's going to be a longer wait. So they're going to take your notes, and then they're going to have to process it to CPS, where if you call the number, you'll talk to the CPS worker then. I mean, you're going to be online for a little while because of the shortage, but I would call CPS first. Well, we must be proactive because abuse isn't going to stop if we don't do anything. And there must be a shift in the way we look at what child abuse is. I know at a young age, I didn't talk about child abuse because no one talked to me about it. And my parents may have known, but I didn't know. So you talk to your children, hey, if this happens to you, make a safety plan. Or as a parent, or mandated reporter, it's important to be aware of what's going on because education is the key to change. And if we educate our community about what's going on and that this is real, it's not just in the movies, we can change a child's life and we can change the statistics. So, thank you. And I'm actually going to pass these out, and on your way out, if you could just fill this out and then leave it